Hello everyone, welcome back to my channel Ask Your Nurse. If this is the first time of seeing my video, you're definitely welcome. Do well to like my channel, subscribe and turn on your notification bell to be the first person to know the next time I upload another new video. And to my returning subscribers, I love you guys. Today we'll be talking about a very important health tip that every woman should know and do, and it is self-breast examination. Every woman should do self-breast examination as from 18 years and above. And let me shock you, men should also do self-breast examination because men can also have breast cancer. Although it is very rare, like 1 in 100 cases of breast cancer, and usually occur in older men from 60 years and above. I'll walk you through what self-breast examination is, why it matters, how it can be done correctly, and the abnormalities you should look out for. Self-breast examination is a monthly practice that can help you detect early changes in your breast health. You should understand that self-breast examination is about knowing your normal. That is, to be familiar with how your breast is normally and naturally, like how it looks like, the size, how it feels, and so on, so that you can quickly notice any abnormality or changes if such occur and take prompt action to prevent complications. Breast cancer was formerly a disease of old age, but women below 40 years of age are now having breast cancer, and early detection is crucial to save lives. When is now the right time to do self-breast examination? The best time to do self-breast examination is 3 to 5 days after your period ends. By that time, your breasts are least likely to be swollen or tender, as there is usually breast tenderness and fullness before menses, which can prevent you from getting the actual state of your breast. And if you don't have menses, for example, pregnant women, breastfeeding mothers, menopausal women, or if you have irregular menses, then you can choose a specific date every month for consistency, and it must be the same date every month. For example, if it is every 1st of the month or 2nd of the month, it should be done like that each month. Now, how can you do self-breast examination? The process of self-breast examination is in 5 steps. Step 1. At this stage, you stand in front of a mirror with your hands by your side and inspect your 2 breasts. And then, with your shoulders straight and your arms on your hips, check and look at the size and shape of your breast. Normally, one breast is usually bigger than the other in most women. Then check the color if there is changes. Check for dimples, for swelling, changes in the nipple, or unusual swelling in the upper arm or your armpit. Now, step 2. You raise your 2 arms and inspect your breast again. Check for any change in shape or size. Check if both nipples move the same way. Check for unusual swelling or change in color of the skin of the breast. Now, step 3. At this stage, you check the nipples of both breasts for discharge of fluid. Gently squeeze each nipple to check if any fluid will come out from them. The fluid could be watery, yellowish, milky, or even bloody fluids. Now, step 4. At this stage, you feel your breast while lying down. Lie down flat on your back and elevate your right shoulder by placing a pillow or folded towel under your right shoulder. Then put your right arm behind your head like so. You will use your left hand to examine your right breast with the pads of your fingers. Then with the pad of your 3 middle fingers, press gently in small circular motion around your right breast, examining the whole breast systematically in a clockwise or anti-clockwise direction, covering the entire breast from the collarbone to top of the abdomen and from the armpits to the cleavages. But if you want to check for lump under arm area, you have to put the raised arm that you put behind your head by your side. Then you check the hollow of your underarm towards your breast in circular motion, and repeat this process for the left breast. Now, the last step, which is step 5, is when you will feel your breast while standing or sitting. You can even do this when you're in the bathroom, because the wet and the slippery skin make this finger to glide easily. Again, use circular motion to feel for any unusual lump or thickened area using a light but firm pressure, and take prompt action if you feel any unusual lump or thickened skin. Now that you have understood how self-breast examination can be done correctly and confidently, I'm going to tell you 10 signs you should not ignore when you notice or feel in your breast when you are doing self-breast examination. Usually, the breast changes throughout lifetime in response to hormonal changes. The breast changes in puberty, during periods, breastfeeding, and during pregnancy. But in all these periods, if you notice any of the signs I'm going to be telling you, don't ignore it and seek immediate medical attention. Number one is inverted or retracted nipple. This is when the nipple points inward instead of outward or prominent, or sometimes like an horizontal crease, or it can turn to one side. Note that if your nipple is naturally inverted, there's no cause for alarm because some people are born like that with inverted nipple. But if you develop a new inverted or retracted nipple, please do not ignore and seek immediate medical attention. Another sign that you should not ignore is persistent rash around the nipple or the areola. The rash might be itchy, red, it can spread outwards, or looks like nipple eczema, but it may be more than a skin issue, so see your doctor immediately. Another sign is change in size and shape of your breast. Naturally, many women have one breast bigger than the other, which is normal, but when one of your breasts suddenly changes in size or shape, please do not ignore it. Another sign you should not ignore is nipple discharge. When fluid is coming out of your nipple when you are not breastfeeding or pregnant, whether spontaneously or when you squeeze it, please see your healthcare professional immediately. The fluid may be milky, greenish, yellowish, which may give a clue of the cause, but don't ignore, especially if it affects only one breast. When you notice an ulceration or sore on the skin of your breast, please don't ignore it. Another one is tethering. This is the pulling in of the skin, looking like a dent in the breast, and you can easily notice this when your arms are raised. Please don't ignore this, as it may be a signal of an underlying health problem. Redness or heat. This is when you are feeling an unusual warmth or heat in your breast. Although having breast tenderness, heat, and redness is common in breastfeeding mothers because bacteria can easily get entrance into the breast through a sore or cracked nipple, but it becomes a red flag if you are not breastfeeding and you're having warmth or heat or redness in your breast, so don't ignore it. Another sign you should not ignore is Podorange sign. This is when the skin of the breast has multiple dips, which makes it look like an orange peel. It occurs when underlying tissue pulls the skin inward. It is a red flag, so don't ignore it. Another sign you should not ignore is breast lump. The best time to feel for lump in your breast is 30 to 5 days after your period ends, because breast is usually lumpy 2 weeks before menses because of hormonal changes. So if you feel any unusual lump in your breast different from your normal breast tissue, please see your doctor immediately. Abnormal breast lump can feel hard and firm rather than normal, soft and rubbery. It can be irregular in shape and not round or smooth. It will be fixed and immobile. That is, it does not move easily under the skin. It usually have rough edges with uneven surface, which usually gets bigger over time. So if you feel this type of lump, please don't ignore and see your doctor immediately. Although not all lumps are harmful, but persistent lump under your armpit or around the collarbone may be a red flag of an underlying breast problem. Another sign is pain. Usually cancerous lumps are not painful initially, so pain in the breast might be something else and not cancer. Mild pain and heaviness in the breast is quite normal before menses, which usually subside after menses or periods. But if your pain is persistent and severe, please see your doctor. Self-breast examination is not a replacement for professional screening. And remember that most breast changes are not cancer, but it is always important to talk to your doctor if you notice anything unusual. Don't forget that knowing your breast could save your life. If you notice any of the signs mentioned, please don't panic, but see your doctor immediately. Now we've come to the end of today's video. Thanks for watching to the end. Do well to like this channel, subscribe for more health tips, share with someone who might find it helpful. Stay proactive, stay healthy, and I'll see you in my next video.